Sorry about that. That got a little mystical back there. Let's return to the Arthurian cycle. While our noble knights of the Round Table prepare the castle to defend against the evil HIV wizard, Lady Guinevere, with the help of the princesses, go to the neighboring village to bring the children and townsfolk back to the castle for safety. Protease inhibitors often have the suffix -navir, such as ritonavir, atazanavir, and indinavir. Hence, our story centers around Guinevere and the princesses. First, notice in the background that we can see Camelot in the distance. Again, to remind you that these are not Knights of the Round Table and do not need a phosphorylation signal. Let's sketch in a knight riding furiously toward the castle with phosphorylation signal scroll in hand to alert King Arthur of the evil retroviral wizard's imminent return. But Guinevere and the protease inhibitors are acting on their own. They do not need intracellular activation. To convey proteases, we usually have a blade cutting a chain of protein. So protease inhibitors are a blade sheathed or stuck in something. And in this case, we have that classic scene of the sword and the stone. Watch as young Galahad tries in vain to pull the sword from its resting place. This is exactly what the protease inhibitors prevent. The reason why HIV even needs proteases is because before HIV can assemble mature viruses, its gene products are translated into long polyproteins. Then HIV proteases must cleave these precursor molecules in order to form the mature virion. Think of young Galahad as too young to pull out the blade. He remains immature, blocked by the protease. The HIV Pol gene encodes HIV enzymes including reverse transcriptases and proteases. To help you remember that the HIV Pol gene codes for HIV proteases, we're going to feature Paul, the village blacksmith, crafting some protease blades. It's these protease blades that Guinevere and the protease inhibitors block. If an exam question involves developing resistance to protease inhibitor drugs, the answer will involve HIV modifying its Pol gene. Pol gene mutations lead to our blacksmith forging some HIV protease variants that are resistant to standard protease inhibitors. So protease inhibitors are never used as monotherapy, as viral resistance to the entire class can form quickly. Let's go over some important metabolic side effects of protease inhibitors. These agents can cause hyperglycemia due to insulin resistance, which may lead to diabetes eventually. To show this, we have Guinevere luring the village children towards her so she can get them to safety. Notice that she's holding up a jar of candy. This is our recurring sketchy symbol for insulin resistance in diabetes, and she's elevating it in order to convey elevated blood sugar levels. Protease inhibitors can also cause dyslipidemias, so she's elevating an enticing stick of butter as well to represent elevated blood triglycerides and LDLs. Protease inhibitors can also cause lipodystrophy. This involves increased fat deposition in the back and abdomen and decreased adipose tissue on the face and extremities. So let's sketch in Guinevere's trusty steed beside her, our recurring symbol for lipodystrophy, whose gracefully thin legs are about to collapse under its more central adiposity. A couple more side effects to mention. Indinavir specifically can lead to nephrolithiasis due to urinary crystallization. Indinavir will be represented by an indigo princess, retrieving some children in the village square. Notice, one of the children is throwing stones into the kidney-shaped basin of the fountain, representing nephrolithiasis. Nephrolithiasis can occur within days of starting indinavir, so patients must maintain adequate hydration when taking indinavir, represented here by one of the village children drinking the likely non-potable and cholera-ridden medieval fountain water. Ugh. Another princess has arrived with Guinevere as well. She sits atop a carriage waiting to take the children back to the castle. But the village children have other ideas. They've dismantled the carriage wheel, rendering it inoperable. This represents the inhibition of the liver cytochrome P450 system. On the carriage, we have our recurring sketchy symbol, a chrome bumper with CYP450 license plate. Inhibition of this cytochrome carriage leads to numerous drug-drug interactions. Ritonavir specifically has the most profound inhibitory effect. That's why we've made these village kids high-fiving. Right on! The potent cytochrome inhibitory properties of ritonavir can actually be used to clinical advantage by having it boost the levels of other protease inhibitor agents that are usually metabolized by the liver. One especially important drug-drug interaction is with rifampin. Remember from our tuberculosis therapy sketch that our rifle-wielding sharpshooter rifampin is a potent inducer of cytochrome P450 metabolism. This decreases serum protease inhibitor levels. As a result, rifampin can be replaced with rifabutin, a less potent CYP450 inducer. To highlight this contraindication of rifampin use with protease inhibitors, one of the evil wizard's henchmen has already arrived, his CYP450 cytochrome carriage speeding into view as the princess runs for her life, rushing the children to safety. Notice his crossbow looks like the rifampin rifle. Alright, it's that time again. Let's sum up the scene. On an exam, you can identify many of the protease inhibitors by the navir suffix. So, this scene features Guinevere and the princesses. Protease inhibitors are antiretroviral agents that work by inhibiting HIV's ability to cleave polyprotein precursors necessary to assemble mature viruses. Think of that protease sword inhibited by the stone. Proteases are coded by the HIV Pol gene, represented by our Smithy Pol. Mutations in this gene can lead to resistance. Important side effects to keep in mind with protease inhibitors are metabolic, and include the insulin resistance and dyslipidemias on the raised platter, as well as the lipodystrophy depicted by Guinevere's noble steed. Ritonavir is often associated with CYP450 inhibition, so we've included the inhibited chrome carriage. And watch out for that rifampin rifle, which can accelerate the liver metabolism of the protease inhibitors. Alright, on to our final scene, where the HIV invasion of Camelot has already begun.